Hello, welcome to the Broken Not Broke interview, the only podcast for cancer families hosted by a cancer dad. I know that you are in the most difficult chapter of your life. I've been there. But I can tell you that the more information you get about the resources provided by nonprofit organizations and other institutions will be better. You will have more information, more resources, because you are not alone. We are a community. Today, first we start with an interview. A great organization called Ocular Insight that focuses on ocular melanoma, or cancer of the eye, a very rare cancer that happens also in kids. You're going to learn about the resources they do and the way they create community. Also, we'll talk about making a budget, a key money tip when you have a financial shock like a diagnosis of childhood cancer. Let's start.
Hi, everyone. We are here at the Broken Not Broke interview. Very excited for our guest today, Melody Burchette. She's the president and founder of Ocular Insight, an organization focused on ocular melanoma. And for us, this is the first time that we're going to be discussing an interview with an organization focused on this rare cancer that unfortunately affects so many people and needs a lot of more awareness. And who better to talk about that Melody? Melody, thank you so much for being with us today.
Thank you so much for having me. I'm honored to be here.
So to start the conversation, I'd love to hear what inspired you to start this organization.
I was inspired because I was diagnosed with ocular melanoma in 2010, and it was a scary place. There was not a lot of good information for patients out there. There was not a lot of resources. There was not even a ribbon color. There was nothing to identify an ocular melanoma patient with the disease, and cancer patients like that tangible something to hold on to identify. And I just saw so much lacking that I thought somebody needs to do something. And so I decided no one else was going to do it. So I did.
Well, that's unfortunately what we hear a lot, either as a patient or as a caregiver. That's my case. You try to start something to support others. Tell us about the core mission of Ocular Insight.
Well, our core mission when we started was financial assistance. We want to help patients because when we were started, the Affordable Care Act had not been passed. There were a lot of patients without insurance. There was a lot of patients that were going without care because they didn't have the means to pay for it. But then there's a whole nother thing, another level. So when a patient is diagnosed, it usually comes out of the blue. They're not expecting it. They have no idea. And they usually have to get treated very quickly. It's just because that's the way the physicians do it, not because there is a need to get treatment fast. But, sometimes you can go to the doctor on Tuesday and being treated on Thursday. So it's very quick for some patients. Some patients have to wait longer. But the biggest thing is that people aren't prepared for no income. They don't have vacation or they don't have enough sick days to cover it. This treatment is over 5 to 7 days. So it's, that's a big chunk of vacation or sick time. And some people don't have that much. Then they don't have a lot of money in their savings because, in America and around the world, actually, people are notorious for not saving for a rainy day for a large chunk of money. So now you're going weeks without a paycheck and trying to figure out how you're going to make ends meet. You just got diagnosed with this crazy rare cancer and you don't have the money to pay for it. The deductibles sometimes are high. So if your deductibles are very high, then how are you going to come up with the money for your deductible? Because it's a one-time thing. You think, I've got a $6,000 deductible over a year, not so bad. But when you have a $6,000 deductible at one time, that can hit you pretty hard. So that's kind of our core mission, is to help patients not on the long term, but to get over the hump. We give them an award based on their income and the state that they live in. And it's to help them get through their diagnosis. It's not to keep going, but help them pay for their copays, help them pay for their prescriptions, help them pay for insurance premium that they might miss because they're not working, their rent, their mortgage, electricity, water, food, gas to get to treatment. And some treatment centers require patients to stay at a hotel. So now you've got a 5 to 7 day hotel bill that you weren't expecting that you have to pay on top of that. So with all of these things, it can be quite a big bill in the front end. So we offer this financial assistance to help them. That's kind of our core mission.
Well, that is wonderful, Melody. I'm sure that the families that you have supported over the years are very thankful for the opportunity to have that award that just let you continue in a very, very tough financial time. Please tell us how the organization has evolved over time. What other programs do you work?
Well, when we first started, started, we were trying to raise money. So we developed awareness products. So that was, we were trying to get a face to ocular melanoma. And then we started with the financial assistance. And then thankfully, we were given a bequest of almost $300,000 that gave us some money that we could really develop some good programs. So we ventured into the education, like larger education. We were always giving education through pamphlets on our website, but we were able to start our podcast, and that helped reach many people that we weren't reaching before. We had a social media presence, we had a website, but we really weren't getting big words out there to people. We were just getting small stories. So with the podcast, it allowed us to do big work with storytelling, both with physicians and with patients. We also started the very first ocular melanoma registry, which then kind of pushed us more into the research field. We'd been doing a little bit with research, but it was small funding because we weren't getting the donations for research. We always were interested in it, but we weren't getting those donations. We were getting donations more for our general fund for patient assistance. So we were able to really dive into the research realm. And with this patient registry, it's very important because researchers can get information out of there about the patient experience. So it can help with research to find better treatments and hopefully a cure one day. So we've evolved that way. We've given more money to research. We've given over $1 million in our lifetime towards research, which is small compared to some of the other organizations, but for a small organization like us, it's a lot of money. So we've evolved more into research. We support research through a new initiative, our biobank. We just opened a biobank. So that way we can grow cell lines and have tissue for researchers to be able to access, because uveal melanoma is rare, so tissue cell lines are hard to come by. So we're hoping that we can help with that. But on the patient side, the way we've evolved more is just by more education. We're offering webinars and our podcast video series. We have our yearly patient meeting that we do. And I think we're just constantly evolving, trying to get more information. We developed an app this last year. So now patients can connect to each other through an app. That way they're not missing each other who are not on social media. They can still all connect that way in a very secure location. And they know, because it's our app, that their information is not going to be sold or used in any way. It's all private to them. So that was a good step in trying to keep patients connected and get them more education.
Well, a lot to talk about, Melody. Congratulations on how the organization has evolved, because you took the awareness part, and then the fact that you're funding research, and for a rare cancer, $1 million is significant.
Yep.
And then connecting people, the registry, the tissue. I think that you are really contributing a lot to this particular field. So congratulations to you and your team for this. Love to hear about these events that you organize, 5Ks and other ways to bring people together.
We have 5Ks in about 10 states where we bring patients and the community together. We team up with a lot of physicians that come out and support. We have one physician in particular that says, I walk shoulder to shoulder with my patients. But that means a lot to patients when they can come and see their physician out there early in the morning walking or running with them. It's a great way to bring the community together, and more importantly, to be able to share awareness of what ocular melanoma is and the importance of a dilated comprehensive eye exam.
May I ask you, about the symptoms or how do you identify this rare cancer so people can get treatment on time?
Well, most people don't know they have it until they get a diagnosis, and it's usually a little bit on the larger side. In America, unfortunately, people don't take their eye care seriously. I've been wearing glasses since I was 10 years old. I did not get dilated eye exams because all I wanted was glasses so I could see. And an optometrist never explained to me why it was important. And I didn't want to pay the extra $20 to $40 to have photos taken. So I did not know that I had any symptoms. I did eventually realize, oh yeah, those were kind of symptoms, but I just went in and had an eye exam because I needed glasses in an hour. I went to a lens crafters and he found it. My optometrist there found it. Some of the symptoms you can have are flashing lights or a shadow in a part of your vision. Some people can experience some kind of like ocular migraine type symptoms, where you're seeing colored lights and kind of like a light show in your eye. So those are the more common symptoms, and then you can actually lose vision, where when you just don't see out of that eye anymore because it's done something to your retina, and your retina is what's responsible to making you see. So some people find it by loss of vision, but most people do not have any symptoms at all.
So how important is to raise awareness through these events and campaigns, webinars, your podcast? Do you have a story that you could share, in particular pediatric, if it's the case?
Yeah. We have a small population of pediatric patients, but they are a mighty group of pediatric patients. There's one that I know of that was born with ocular melanoma, and he also has a blue nevi syndrome, which go hand in hand. They share the same genetic component. And it's uncommon, but it's not impossible for patients to be diagnosed with ocular melanoma in their younger years. And it's usually not picked up right away because it's not something that physicians are looking for. Also, most people don't take their children in to get dilated eye exams, so it's not found. So it's usually found because there's a symptom, there's something that's happening, they fail an eye test at school, or they start having some visual disturbance and they tell their parents. So we have a group of what's known to me of about 10 pediatric patients. And this is a big, heavy burden for them because now they lose their eye or they lose vision in their eye, which makes their day-to-day activities a little bit tougher. If they were involved in sports, sometimes they have to relearn how to do that sport. We have this one gentleman. He's in his 20s, or actually, I think he's 19 right now, and he was a pitcher for baseball, and he had to learn how to pitch again. But he's doing it, and he's doing fine, and he has a really great life. He's in college. He's still pitching baseball, and he's doing really, really well. Yeah. Then we have had a few that have had metastatic disease, and that's very sad because they're so young. But it is definitely a possibility. But I'm amazed at our pediatric patients because they go through a lot. I mean, this is a lifetime cancer. It's not a 5 years and you're done cancer. So these children are going to be dealing with having routine scanning for the rest of their lives because you never know when this might come back.
Well, thanks for sharing the story of this group of pediatric patients. We want to talk about the big picture, Melody. You know, what do you think is the main issues where the systems fall short? You know, the insurance, the employment, the services. How can that change for patients of ocular melanoma?
Well, insurance reform would be helpful first. We have a big insurance problem in America. I don't really have the answer to how it could be reformed, but we need to bring premiums down. We need to bring copays and deductibles down. So many of our patients cannot afford their monthly premiums, and so that they have to get really high deductibles. And then when you have a catastrophic illness, where you're going to get hit with a very large bill very quickly, having a large deductible can be detrimental to the financial stability of that family. So insurance is very difficult. Also, we need to educate the insurance community about rare cancers because they try to lump us in with other cancers, which the treatments are not always the same. So now we've got a lot of things happening on the patient side where they're having to do appeals and they get denied, and their physician's office is working as hard as they can to get it approved, whatever the treatment might be. But it's difficult because they're lumping us in with something else that is not necessary. Like we need to have MRIs, and they don't want to pay for MRIs. They want to make us do something else. And so it's difficult for that, you know, for patients to go through that, already dealing with this heavy burden of this cancer that they never heard of. And now they have to educate their insurance company as to why they need these treatments. So that's a huge thing. As far as on the employment side, you know, there's a lot of concessions that can be made that a lot of patients don't know about, such as, you know, computer screens, larger fonts. So, you know, trying to get the concessions at work more readily available because people don't understand about vision issues. We're not blind. We just have vision issues, and vision issues can make working sometimes more difficult. And our employers don't always understand that. Well, you can see your eye looks fine. Well, my eye looks fine, but my eye doesn't work fine. So you're now working with one eye, and your eyes are connected, and things happen in your brain, and so some things, sometimes processing gets slowed down a little bit just because we're trying to manipulate with one eye, or with disrupted vision out of the other eye, which makes our eyes get tired, and computer work can be hard. So the concessions at work, it would be helpful for employers to be a little bit more broad. They tend to be really narrow in their concessions. They can make you a handicap accessible desk, which is great, but we're not in wheelchairs, or we're not on crutches, or we just need a bigger monitor, which they don't always provide. So there does need to be a little bit more information about concessions for health related issues on all fronts, because not every one of us needs the same concessions, and they tend to lump us all together. And I think that's the big story: is don't lump us together. We're all unique. All cancers and all illnesses they have their own unique challenges that need to be met. And insurance is not a one size fits all, and neither is employment concessions. So some of the disability acts could be a little bit more broad. Some of the insurance reform needs to be a little bit more broad. But the biggest story that I'm hearing in the community on insurance reform is bring the premiums down and bring the deductibles down. The deductibles are just way too high.
Well, those are big challenges that I believe organizations like yours are making a difference to raise awareness and for advocacy. I'd love to hear more about the app. I think is such a unique tool to bring people together. I love the concept of communication in a secure way. How does that came to be, and what have you observed through the app?
Well, I've been trying to develop one for many years, but I couldn't find a developer that could give us what we wanted. So we found a developer that has an app that we could customize. So we didn't have to start from scratch. The basis was there, and then we just customized it to fit our community. And how our app works is it's a mix. If you think about social media, it's a little bit like Facebook, a little bit like X, a little bit like Reddit. There's different places you can go for different information. So we have a general feed, which works like Twitter. You just go on, and then the people are talking and asking questions. Then we have rooms that are kind of divided up as to the different kinds of ocular melanoma. There's uveal melanoma, there's conjunctival melanoma, there's metastatic melanoma. They can go into these little rooms, and then it's a more intimate conversation space. And then we have other topics that work more like Reddit. So if you have a prosthetic and you want to talk about prosthetic eyes, there's a room for prosthetic eyes where they can go in and get information there. And then we also have information available on other nonprofits that are in there, resources, travel resources, just different things that might be helpful to a patient to find, so they don't have to Google search on every single thing that they need. There's a nice resource list in there. So they have lots of different things, places that they can go for information and connect with each other. There's a chat feature that they can just chat one-on-one with somebody that isn't in the big space. And there's also a journal, so they can go in there and they can journal. They can keep notes in there. So when they go to their doctor, they can just pull up the app and there's all their notes right there that they can ask them. So it makes it simple because most people have their phone on them all the time.
Well, what a fantastic idea. I think is visionary and is distinct, and is probably making such a difference for the members of this community. Melody, how does people can reach out to Ocular Insight?
They can reach us through email at contact@acureinsight.org. They can go to our website, acureinsight.org, or they can call the phone number, which is 919-885-5264.
Well, that is wonderful. I'm sure a lot of people, families, social workers, and other advocates will be very interested in the great work that Ocular Insight is doing. Again, congratulations to you as a founder and everyone working in this great team that you have. We always say when we finish the interview, if you can donate, please do. organizations like A Cure Insight make a difference, but they need funds. So for those who can offer resources, either volunteering or donations, please visit A Cure Insight. Thank you so much for your time, Melody. It was a pleasure meeting you. It's a pleasure talking to you and learning more about this great organization.
Thank you so much. So proud to be here.
We know you are heartbroken, but you don't need to end financially broke. That's the reason that we like to give some money management tips in this podcast. The first one I will tell you is make a budget. You might have already one, but especially in this situation, you will see your expenses go very, very, very high, and sometimes your income to be reduced. This is what happens to all cancer families. Therefore, knowing where your money is going will make a huge difference. Make a note of your variable expenses or your fixed expenses, as well as the income that you are receiving. This will help you for two reasons. One, you will feel more in control of your finances when they are changing so fast, but also many organizations that provide financial assistance will ask for some information like this. And if you can show them where the money is going, they will be able to provide better support. So remember, in this chaotic situation that you're living, knowing where your money is and how you're spending it will make a difference. Thank you so much for being with us today. I want to remind you that in brokenNotbroke.org, you can find more than 400 nonprofit organizations that provide financial assistance to cancer families. You just have to give your state, the type of cancer, and the type of financial support, and you'll get a list of organizations that you can reach out, or you can ask your social worker to reach out for financial assistance. Thank you again. And please visit us in our socials, as well here in our YouTube channel or Spotify. Don't forget to subscribe, like, share, and comment. Thank you so much, our producer, Vanessa Toro, and we'll see you in the next episode of the Broken Not Broke interview.